We'll make a start. We'll have some others join us as we go. But we have an exciting hour and we want to make the use of all of it. So let's get stuck straight in. It's so lovely to join you this morning for the launch of our Sector Voices report. Thank you for making the time. And again, thank you for participating across the last 6 months in what has been a really exciting piece of work for us at Peak Care together with the sector. I would like to start by formally acknowledging traditional owners on whose lands we are meeting today. For Peak Care, we're joining you from the lands of the Turrbal and Yagara people. And I want to extend that acknowledgement to the traditional owners of all lands across Queensland in which you are working and joining us from today, and that we are delivering services and supports to children, families and communities. I want to also extend that acknowledgement to any First Nations people who are joining us online today, as well as all those who have shared their wisdom, living experience and culture with us through the process of the Sector Voices tour. And in our work collectively as we seek to address the overrepresentation that exists within our service systems. And we know that we can and must do better as a system to support our First Nations people. Welcome and a really exciting launch of what has been a really great piece of engagement and collaboration across the Child and Family Service System in Queensland. I want to acknowledge, one, that this is the culmination of 6 months worth of kind of regional engagement, regional participation, but also hearing from so many voices across Queensland in terms of, one, what is going really well, but also what are those opportunities that exist across our service system to be doing better, to be tapping into the potential that we have, as well as how do we help continue to shape a system. It's really exciting to be launching this piece and acknowledging, one, this is a milestone of where we've reached in terms of all of the voices that have shared been shared over the last 6 months, but also a start for us in terms of advocacy around those priorities. I'm going to take you through the agenda of what we're going to talk about today, then do a bit of scene setting, but I'm really excited also that we're going to have the Peak Care team take you through what we heard, the report, and kind of some of the actions that we're going to be delivering as your peak body. So what we will go through is the report itself, which formally launches today, and you will find a link to the report in the Q&A section of this presentation. So if you click on Q&A, you will see a link which will take you into the report shortly. The report is also available and published on the Peak Care website, and a link to the report will be shared following this session. But the report itself kind of covers 4 key areas. One is very much centered on children and young people. The critical importance of relationships and collaboration across and through our system and with our service partners as part of holistic service responses to children and families. A whole of system lens. We know reform needs to be approached from a whole of systems perspective, and underpinning every single thing we do is the workforce, and valuing and also investing in our workforce and our people. There will be an opportunity, and we're really keen to hear your thoughts, views and questions. So we will have a Q&A session following that, and we really encourage you, if you have questions as we go, to please put them in the Q&A. You'll also be able to come off mute and ask directly at that point. But if there's things that come up as we are talking, please make sure that you share those with us so we can capture those, answer your questions. And as much as possible, if we can, we will answer them in session. Otherwise, we'll circle back with anything that we can't answer in the next hour. And then a bit of a plan for what are we going to do with all this information? Because as I mentioned at the start, this is the commencement for us of the next stage of Sector Voices, which is actually delivering on what we've heard. And it's really important for us. Is one of the things that we heard over and over again in the conversations that we had across Queensland was that these are very similar conversations to what we had in 2021 and similar to what we talked about in 2019. Our hope is that in the work that we do collectively is in 2 years' time, we're having a different conversation, and that we've overcome some of these challenges, and that gives us an opportunity to talk differently about some of them, because we know we have some significant opportunities and significant challenges in our system to overcome. For us at Peak Care, this is about how we set that path forward. So to give you a bit of a scene set for those who participated in the Sector Voices tour between July and November of last year, or contributed in your own way, I want to kind of just center us back in what we've actually done. So if I could have the next slide, please. So we know in Queensland, and you'll live and breathe this every day through the work that you do, that we are supporting kind of almost 16,000 children who are receiving support of the system. We know, particularly in Queensland, that Queensland has, unlike other states and territories, kind of a significant residential care response to what is a whole of system issue. And we're currently situated disproportionately with a lot of demand on part of our system, which is stepping up to meet that demand, but we know that we need to move those levers upstream to reduce that demand. And at the current rate, we have almost 2,100 children in that part of our system, residential care, including significant numbers under the age of 12. And we know that there's a lot of work that needs to be done in terms of shifting that dial. And we know that happens much more broadly than just in that residential care part of our system. So I want to acknowledge that at the outset, that what we're seeking to achieve here is whole of systems focus. We know residential care has and continues to be an important focus area, but when we think about the sector voices and the work of peak care, it's about the whole of the child and family service system. The other component of that, which you'll be very familiar with, is across Australia and in Queensland, we are seeing and experiencing increasing and compounding pressures because of reducing capacity and reducing numbers of foster carers. Now, that's not just a Queensland challenge, that's an Australian and international challenge. And there's a lot of work that's needed there, as well as how we adapt to a new system where we will just see fewer foster carers as part of our system than we had before. Next slide, please. For those who are familiar, though, that you will probably be very exhausted with the amount of recommendations and opportunities and reviews and insights that the child and family service system seems to get. And many of you may have seen this, but I think it's really important to consider when we actually put forward actions that this isn't done in isolation to everything else that's occurring and all the other considerations that we need to make. And over the last 12 years, there's been 61 reports and over 3,000 recommendations made into Australia's child protection systems, which is a lot of recommendations. But really, when you distill those recommendations down, they actually only revolve around 6 key themes. And those key themes are central to how we are seeking to address some of those priority areas through our Sector Voices report and through peak care's broader advocacy, because we know they are the 6 core components that will see the most significant change. So we know that inadequate investment across our systems, particularly inadequate investment in the earliest parts of our systems through prevention and early intervention, is driving more children and families towards the tertiary end of our system. Workforce capacity is a really critical enabler of that. And we have both this work and the broader work of peak care in terms of the workforce and the future of our workforce. Information sharing is a perennial challenge for us, oversight and transparency, and opportunities for children and young people and families to participate in decisions that affect them and be active contributors to that. We also know that there is significant work occurring and acknowledge and value the work of our partners and the work of all organisations in the transition of funding and the delegation of authority, but also the genuine valuing of partnerships with our First Nations organisations and partners. And there is great work starting and we need to continue that great work. Next slide, please. So in doing that, as the peak body for child and family services, we were genuinely committed and remain genuinely committed to making sure that in all of the advocacy work that we do, we hear from you and you see your voice, your interests, your views and values reflected through the work of peak care. As your peak body, that is what we're here for, and we're here to represent the child and family service system through our member base and through your expertise and contributions. So the Sector Voices is intended to do exactly that. It's to hear from you about what your interests, priorities, challenges, hopes and aspirations are for our system, and to set an advocacy agenda that's based on that. And I hope that in having the opportunity to see the actions that we've identified, is you'll see your voice reflected through those. So we want to make sure you're feeling heard, but we also want to make sure that you can see your voice reflected directly. I will acknowledge that there is 38 actions and kind of a lot more was shared. So a lot of that will happen as part of our core advocacy. A lot has already been shared, but these are the things that we think are consistently going to make the biggest difference for us. What we did is we met with more than 250 people across 11 it was 10 workshops, individual site visits as well, across the entirety of the state. So all the way from Brisbane, southeast corner, all the way through to Cairns. So we went to every part of our state and made sure that we were represented in every region within Queensland to hear directly what your challenges, your issues and opportunities were, and then what that looked like for each region. So we know that the issues and opportunities that exist within Far North Queensland are different from those that exist within Southwest. We know that not every challenge in Southeast Queensland is experienced in the same way in Central Queensland. So what we have intended to do is we have a statewide report which reflects the nuances of regional areas. And towards the back of our report, you can see that. driven through. So I have touched on the key themes, and we'll present to you in terms of those actions based on those key themes and how we've oriented them. But we believe that they are, from an advocacy perspective, how we're able to join up a holistic platform of advocacy over the coming years for our sector, underpinned by the fact that this is about people and workforce, and really what we do is support human connection through our work, and the workforce is the enabler of all of the actions that we've put forward today. Next slide, please. So what we're going to do is I'm going to introduce you to the team who delivers Sector Voices. They're going to present to you what they heard and what we're going to do about it, and then I'll come back to talk about workforce. So I'm delighted to present the 3 members of PCARE who actually did Sector Voices, which is absolutely wonderful to have so much of PCARE out in the regions and for you to be able to engage with kind of the full breadth of the PCARE team through this work. So Kate, who will be talking first, is our Executive Director of Research and Advocacy. We have Elizabeth Hanson, who leads kind of Research and Advocacy Advisory team as the Senior Advisor, and Gail Walters, who everyone who's been in a workshop with Gail will remember is the powerhouse that sits behind our strategy and communications team. So I'll hand over to Kate to start us off with children and young people, and I'll talk to you again when we get to workforce. Thanks, Kate.
Hi, everybody. I've been looking at the attendee list and I see lots of familiar names, lots of people that we spoke to, and I'm so thrilled that you're all here. I can't tell you how grateful I am for all of your insights that have led to this report, and I hope that you do see your voices throughout the report. So Elizabeth had the idea to engage a scribe to see if they could visually represent what we had heard across the state. And so each of our subtopics has got these amazing little images, which I'm going to stick around my desk and just remember exactly what you told us. So in terms of children and young people, one of PCARE's core principles is that children and young people are at the centre of everything we do. So we were really excited to hear from our member organisations through the workshops. Gosh, we didn't need to tell you much. You have got across the state so many incredible, innovative ways of being guided by young people's views. And the children that you work with are involved in day-to-day decisions about what the activities might be in a residential care home, what they might eat, around their case planning, and then also some really incredible models for larger influences on the organisation. We heard about young people on selection panels for employees. We heard about young people, groups of young people actually creating innovative models. There was a group of young people in the Sunshine Coast who were working together to create what their aftercare model would look like. And then they got to be the first young people to trial out that new model for the organisation. So what we really wanted to hear then was, how can we, as your peak body, take all of those wonderful things that you're hearing from the young people that you're working with, and the staff who work with them every day are hearing their views, and how can we raise those voices up into a systemic change that needs to happen based on what the young people are telling us. We talked a lot at our workshops about not wanting to recreate or replicate any of the amazing work being done by organisations like Create and Office of the Public Guardian through the Community Visitor Program. And interestingly, the further away we got from the larger city centres, the more our organisations, our members were saying, be here, come often, speak to our young people directly. We're not over-consulted, we're under-consulted. We know our young people would feel empowered by being able to tell you their stories. So all of those things led us to a series of actions. Just this next section is about the actions just related to raising up the voices of children and young people. We're in the middle now of consulting with some young people that we know who've got current living experience as well as lived experience of the various systems that we are advocating about, and developing a youth engagement framework that guides how we do that work. We would also like to involve young people in and partner with the Queensland Government for a generational plan for child and family services, because some of the things that young people tell us they need are going to result in outcomes in the further longer term future. And with children at the centre of everything we do, we're also working towards Peak Care becoming a child-safe organisation in partnership with the Queensland Family and Child Commission. We know that children's rights need to sit at the centre of all of our work, so we've also committed to working with partners such as the Queensland Human Rights Commission, just to centre child's rights across the system. And that very much relates to the next action about there was in some places we talked about a shift in language and also in modelling from clients, young people as clients, to that child-focused model of care, which keeps children's rights, children's voices and children's entitlements and needs right at the centre of everything we do. And the last set of actions around this topic involve, years and years ago, Peak Care talked about community visitors when the initiative was first developed, and people were pretty excited about it back then. We also heard that people around the state really value community visitors and in almost all locations said we would love them to come more often, and how important is that relationship, the continuity of that relationship. So we'll be working with the Office of the Public Guardian to advocate for that. The development and implementation of a practice framework for extended post-care support. Again, huge amount of support for the scheme, and the next steps will be hearing from young people about what's working for them in that space so that we can really embed what best practice looks like across the state. As I said, we heard that in some places, young people and staff and member organisations would love to see and hear more of us. So we're going to expand our regional footprint to include a permanent presence in the northern part of the state. And finally, developing and tailoring more developmentally appropriate opportunities for younger children to have their voices heard. We're going to have to think carefully about how we do that in a safe way in partnership with you, using the trusted relationships that already exist and through some of those mainstream services. I'm hoping that we get some questions later, but I'm going to hand over to Elizabeth to talk about relationships and collaboration.
Thank you, Kate, and good morning, everyone. Echoing the comments of my colleagues, it has been a privilege to travel across Queensland and meet so many of our dedicated sector members. To hear directly from our members on the work they are doing to support children and their families while navigating an increasingly complex landscape is inspiring. As we travelled further into regional Queensland, it became evident that strong local collaboration was sometimes not matched by interagency coordination at a government level. Participants consistently highlighted challenges in communication, not only in receiving clear, timely and factual information, but also in working through inconsistencies in processes and procedures between regions. It was evident in some cases that the same programs and services were being implemented very differently between regions. This can and has at times resulted in additional complexity in funding arrangements, additional reporting burdens for organisations, and ultimately means the system is not able to provide the best possible outcomes for children and families. One key frustration raised was the lack of regional flexibility in centrally funded programs. While regional allowances exist, the process for applying these adjustments remains unclear. In many cases, funding models fail to reflect the realities of workforce shortages, vast travel distances, and the administrative burdens placed on providers operating across multiple regions. Larger service providers shared that contract specifications vary significantly between locations, creating unnecessary complexity and additional workload, often without accounting for essential operational costs such as professional development, contract management, supervision, and administrative support. Participants strongly advocated for a more collaborative approach to policy design, one where government and the sector work together to develop funding models that are clear, consistent, and adaptable to regional needs. By ensuring early sector involvement, we can reduce administrative burdens, improve service efficiencies, and create more flexible funding mechanisms that ultimately lead to better outcomes for children, young people, and families. Beyond funding and contract management, there was a strong sector-wide call for greater investment in prevention and early intervention. The message was clear: we must prioritise wraparound support models that keep children safely at home wherever possible. Participants strongly supported a big shift away from traditional child protection models towards family engagement approaches that work with the entire household to build capacity and resilience. By investing in evidence-based, family-led solutions, we can reduce reliance on out-of-home care and create a system that breaks cycles of intergenerational intervention rather than perpetuating them. Despite the challenges raised, the overwhelming sentiment from the workshops was one of optimism. Attendees were generous in thinking big, envisioning a future where the sector is strategically resourced, sustainably funded, and empowered to innovate. Through collaborative design, consistent investment practices, and funding flexibility, we can build a more responsive and resilient system, one that not only meets current needs, but is adaptive for the future of Queensland's children, young people, and families. With these insights in mind, it is clear that meaningful change requires action. As a sector, we cannot afford to simply acknowledge these challenges. We must actively work towards solutions. That is why Peak Care is committed to delivering the statewide Sector Voices survey and statewide workshop series on a biannual basis and visit at least one region per quarter to keep the conversation going. We're committed to advocating for the implementation of a statewide strategic approach to family finding and kin support and improve kinship carer advocacy services to ensure that they are considered distinct from foster care. We're committed to advocating for improvements to the implementation of any new investment specifications and ensure rollout activities are consistent, well-planned, and communicated across regions. We're committed to working with government to ensure complete, accurate, and timely government data is available to the sector to inform future service delivery changes. We're committed to advocating for the expansion of Carer Connect to enable critical information to be provided to non-family-based care workers and organisations. We're committed to partnering with government to refresh the current model of residential care to better reflect a contemporary range of evidence-based intensive therapeutic care models supported by a standardised assessment pathway. We're committed to partnering with government and service providers to undertake an assessment of the actual cost of care to inform the review and update of funding and pricing guidelines. We're committed to working with government to investigate opportunities to streamline access to ex gratia payments and reimbursements that relate to the care of children. We're committed to working with government and service providers to address gaps in the functions provided by the Unify system, and we're committed to advocating for improved commissioning and procurement practices as an avenue to creating statewide consistency in funding terms and contracts and increased flexibility to adjust changing conditions. We're really excited to carry the sector's voice in these discussions with government and making sure we can see changes happening in how we can continue to collaborate and build stronger relationships. I will now hand over to Gail, who will speak to the whole of systems theme.
Thank you very much, Elizabeth, and thank you, Kate. And let me also reinforce the absolute joy and pleasure that it was to be able to travel the state and to talk to you, our members, and to listen with you as you talk to us about what you are experiencing on the ground in your region and the great work, the exceptional work that you do every single day for the children and families across our sector. We know that in the past 5 years, this sector has experienced unprecedented change. Wouldn't it be nice to live in precedented times? We can just remember what they once were. But since COVID, the sector has demonstrated such significant resilience in the face of the complex and compounding challenges that we face every day. We heard really clearly from the sector that they continue to face these challenges and the overwhelming demand and the increasing social complexities which are placing a strain on our families and on our communities. We know that our children are unfortunately not as safe as we would hope they would be. Our sector sees this firsthand. With the increased number of children and young people experiencing trauma, extreme disadvantage, and exposure to domestic and family violence on a daily basis. This increased demand on our sector, and coupled with the rising number of young people and families intersecting with that child protection services, highlights this urgent need for more adequate prevention and early intervention and family supports. Societal change is complex, generational, and unfortunately, there are no quick solutions. To achieve meaningful and lasting change, it requires sustained effort and a strategic action. To create generational change, we need to start, and we need to start now. To improve the system, it won't happen quickly, But Peak Care is building a strong foundation to take your voice, the sector voice, to a positive position of change. Our advocacy is your voice, and we will create closer collaboration with all government agencies to achieve better outcomes for Queensland's children and families. This whole of system change can only occur if all parties and all agencies come to the table and can commit and agree to working together. As Elizabeth highlighted, there is such importance in the value of the collaboration that we have, and your voice as our sector is really key in making sure that we can bring government, sector agencies, cross-sector agencies, other peak bodies to the table to cover off on these issues. We already work very closely with many other peak bodies. We build strong partnerships across those sectors, which include health, housing, and education, to support families and children and to create this generational change. Participants in these sessions have strongly advocated for these increased early intervention services, particularly for those children under the age of 5, highlighting the importance of family prevention and preservation. Our sector would clearly like to move from crisis response to creating a stable environment to support family reunification efforts. Participants across the state highlighted the high rate of suspensions and exclusions for students in our schools, and this further exacerbates the educational setbacks for these children and young people. Around 7% of Queensland students experience a student disciplinary absence. So 93% of kids go to school every day. All great, fantastic, not a problem. But of these 7%, which is around 45,000 students in Queensland, 15% of those students identify as First Nations, 15% identify as a student with a disability, and nearly 25% of these students are identified as a child with out-of-home care. An independent inquiry in 2023 found that Queensland students with a disability had been denied 107,000 school days due to suspension. To manage the student disciplinary absences, we heard very clearly from many of our sector and many of our organisations how they proactively engage with schools, how youth workers and caseworkers attend school meetings, participate in discussions and planning for the young people, and advocate for them to ensure that they have an educational need that is not being met that can be met. If every day counts, then we need to keep children at school all day, every day. As I mentioned earlier, Peak Care is already working with a number of key partners, in particular in education, to identify these opportunities and to focus on improving keeping students at school and learning and engaged. This leads to the set of actions that we will be undertaking. We'll be working across the government agencies, child safety, health, education, housing, to ensure these early interventions, the health assessments that need to occur, and the supports that get put into place to ensure young people remain engaged in education and training. We'll partner with government to consider the opportunities for transitions of defined case management functions for non-government organisations. We will strongly advocate for increased investment in community-based residential and non-residential drug and alcohol support services. Through traditional and social media channels, it's time to reframe the narrative. It's time to change the way we talk about young people, particularly in residential care, and it's time for public to recognise and celebrate the important work that our residential care workers undertake every single day in protecting our children and keeping them safe. And part of this will be delivered through our Catalyst for Care program and the showcase event, which will occur late in October this year. We will advocate for more resources to be allocated to support families and children in the home and ensuring that every child has equitable access to health support and early education. Legislative reform takes a while, but we're there and we're committed. And we're looking to look at legislative reform in education, requiring young people in care to be guaranteed to receive a minimum number of hours of education every week. We will work with the Department of Education to undertake an audit of all school engagement and participation of children who identify as children who are in care and look at the gaps and the opportunities to improve their educational outcomes. We will partner with the Department of Families, Seniors, Disability Services and Child Safety to undertake a pilot program to provide a child safety officer in each service centre to look at building better communication between schools and frontline child safety staff and support increased educational engagement and participation of young people and children in care. And we will continue, of course, to work with our key partners, including in education, to get the Department of Education and other areas such as principals associations to include changes to the Education General Provisions Act for suspension as a last resort. I'd now like to acknowledge Tom joining us again to talk about the number one issue that is facing our sector, but also every sector across all of Queensland: workforce.
Thank you, Gail, and thank you, Kate and Elizabeth, for taking us through some of those actions. It's an ambitious range of actions, and it's been intentional that we've done that. One, because you were very ambitious in terms of your ask of us as your peak body and how you'd like to be represented. And the key priorities that we have as a service system in terms of the aspirations that we have for supporting children and families and their communities. But we know underpinning all of that needs to be a strong, recognised and valued workforce that's able to turn up every day for children and families. And that workforce extends beyond the non-government sector to also reflect the critical importance of the partnerships that we have with the government sector across health, education, housing and child safety and disability services. So workforce is the number one issue across almost all service systems in Australia. It will continue to be so. And we know that getting workforce right will be the critical enabler for many of the other actions that we've put forward today. We will see unprecedented demand across Queensland over the coming 10 years, and we will see another 800,000 people move to Queensland. That is the projection. The silver lining of that is that adults will be moving to Queensland at 4 times the rate of children. And that in 10 years' time, we will see a shift where Queensland will actually have proportionately fewer teenagers than they have today. So we will have that capacity to build into a workforce. But we also know that we will continue to see strain in our regional areas and increased pressure placed on our regional areas who will not see that same population growth that we see in our southeast corridor. We know that there is significant work to do, and while there is work ongoing in the residential care space through the development of Queensland's workforce strategy for residential care, that doesn't reflect the holistic workforce needs of the entire child and family service system. So the opportunities that we've identified and actions we've identified for workforce reflect that broader view, and also acknowledge that there is very specific ongoing and detailed work specifically related to how we grow the future workforce for residential care. Some of you will join us next week for our workshops in Brisbane, looking at the theory of change that underpins the future of residential care workforce. But these actions are intended to go hand in glove with those more specific actions relating to residential care, acknowledging that people who are turning up every day to do prevention, to support our foster carers, our kinship carers, and our allied health supports for children and families are just as critical to our service system's success and the outcomes they deliver for children and families. So if we could move to the actions, please. So one of the things that we heard really clearly in regional areas, particularly as we went further north, is flexibility and opportunities for organisations to be able to adapt to those incentives they know that attract and keep really great staff in community, and how we can actually build in those mechanisms that allow organisations to incentivise, attract, retain, and support the recruitment of staff to stay in and work in regional areas. So how can we actually underpin that with good investment to allow those initiatives to flourish? We also know really clearly that we rub against some significant pain points between the way that the funding arrangements exist in Queensland and other states and the application of the award that underpins the delivery of the majority of child and family services in Queensland. That we know that there are some challenges and complexities that we need to really understand, and that needs to be considered in the redesign of funding models and advocacy around approaches. The SHADS award is by no means a perfect instrument for many things, but we need to be really intentional about how we look at that in terms of the redesign of our workforces and the funding that supports that. So we want to have a look at what are those pain points, particularly as they relate to more contemporary changes to SHADS around on-call provisions and shift duration, which are causing grief. We were told really clearly by organisations across the state that there are opportunities to review, standardise and make more consistent and fair the quality review process, standards of care process, and the oversight around kind of regulations and the Human Services Quality Framework that applies to licensed care services. So there is an absolute consistent and unified view of wanting to deliver high quality services. But we know because of some of the bureaucracy and complexity and organic growth of those monitoring frameworks over time that sometimes they are not in their most helpful state for organisations, and that organisations are sometimes working at a disadvantage. So we would like a review of those oversight processes and to work with government around the simplification and standardisation through the review of things like the Human Services Quality Framework to ensure organisations are held accountable for delivering quality outcomes in a way that supports those outcomes. We also need to know, and building on the commitments that have been previously made, is to look at the licensing process for residential care services, how we modernise that licensing process, how do we ensure that there is equity and fairness across our entire service system, but at the end of the day, that what we have is a scaffold that gives the greatest possible care and support to those children and families who need it most. And we know that in some cases, the current licensing system is not able to provide that, particularly for small and medium-sized organisations, and creates adverse disincentives for care. So we need to look at what a future licensing model that supports the system and the non-government sector that we want delivering those services looks like. We also know that we can't do this in isolation to the entire service system and then those related service systems. So it's critically important that we are, in designing any new workforce, that we are working across not just government, not just the sector, but also through our academic lens, our industry lens. What those jobs and skill councils at a state and federal level are telling us will be the changes that are being made, particularly to kind of Fair Work Commission requirements, as well as education pathways, changes to certificates and diplomas, and what that means for our sector and how we can best capitalise on that to build a robust and sustainable sector. We've seen and have great success in employment readiness programs across the state. And we know that programs that can actually channel workers into the child and family space is a really valuable resource for organisations. So we'll be advocating for the expansion of those employment readiness programs that identify people wanting to come and work in the child and family space and give them a supported pathway, and also support employers identifying the best workers for their services. Universities and organisations want a greater partnership around paid placements. We see some great early work in the department. I want to acknowledge the department's leadership in the work of paid placements for university students to move them in to see the child and family services space as a really attractive employment and graduate pathway. We know through the University Accords the work has been done to identify payment of students to support their placements in some vocations, but there's opportunities for us to work more closely around what that would look like, particularly where we're able to give students an opportunity to do placements in regional areas that might then attract them to continue on that work in that same organisation, in that same region. We also need to look at what that looks like, not just from a paid placement perspective, that's just one opportunity, but also in terms of graduate pathways. And organisations who are putting up their hand to say, we're really keen to work hand in glove with universities to support students into work. And there's a really keen willingness from the universities as well to take up that opportunity. And I think working between peaks, universities, sector and government, we can create a really great pathway for our future workers to come into our system as the preferred workplace. In every region, they identified that there are absolute benefits in having consistent standard trauma-informed training, and the Hope and Healing Training Framework and associated practices for residential care and foster care continue to be held as a high benchmark, both in Queensland as well as internationally, and what we see in the literature in terms of Queensland being one of the few states that actually has a standardised framework like this. However, what we don't have, and we know is a gap, is we don't have something that actually offers that to kinship carers. So there is a call, and Peak Care will be continuing to advocate for an opportunity to create that consistent trauma-informed care framework to support kinship carers, as well as workers who support our kinship carers, who are distinct from foster carers and need to be supported in a distinct way that reflects their individual needs and the unique care provided through kinship carers. And finally, and this is an opportunity that we're really keen to pursue and has been advocated for from a number of organisations who work across jurisdictions, is how can we actually prioritise at that higher skills level pathways into child and family services, like what is currently happening through the Masters of Social Work Child and Family Practice, which is being trialled in our southern states, around actually identifying the unique and specialist skills, attributes and practice acumen that is required to deliver really high quality care services to children and families, and how we may be able to set up a trial that can support Queensland students into a guided pathway into delivering great child and family service outcomes in partnership with our universities. We know that we need to do everything we can to move our graduates into our sector, and that's another opportunity that we're seeing significant success we'd like to trial in Queensland. Next slide, please. So that is 38 action-packed actions, recommendations, and opportunities that we will be taking on and over the coming years advocating for. As I mentioned at the start of our presentation, our intention is that in 2 years' time, when we have the next round of statewide sector voices tours, we are not talking about the same thing. Because 2 years ago we have been, and we haven't yet shifted the dial significantly on many of these entrenched issues. So our work will be about how do we create a space that does shift that dial so we can have that conversation about the next round of opportunities and challenges, rather than the perennial conversation about the entrenched issue that we are yet to fix. And that requires us to acknowledge both the role of government and the role of the sector in how we're actually working together to overcome these challenges or embrace these opportunities. I do want to open it up now, though, for any questions that you may have, and I'll invite you one if you would like to. You've got the Q&A function, but I know this group and I know you're very vocal and excited. So if there's anyone who'd like to come off mute and make any reflections or ask any questions of us on anything that you've heard this morning, and we'll just hold for a few minutes for those who may want to do that. There is the gestures button. You can raise your hand. I believe that if anyone has any questions or comments at this time based on what you've heard so far.
Hi, Tom. Just as people are thinking and gathering their thoughts, there is a question there in the Q&A that came through a little earlier today, and it's around housing there for you. If you'd be happy to answer that one. It's around the impact of housing shortages in regional areas, and what is Peak Care's part of the action plan? How might that work for Peak Care's advocacy?
Fantastic. Thank you, Bianca. And that's a really great question, because we're really attuned to probably one of the single biggest issues. And we say the single biggest issue in Queensland is workforce, but I'd say that's a hard fought challenge, with the single biggest issue also being housing. And that's being experienced by our children and families across the state, but also by our workforce and also by organisations who require housing as part of their service delivery. So we need to be looking at how our system both kind of needs to draw on the resource of housing, but also what housing is in terms of a causal factor of many of the challenges that are being faced by children and families. Many of you in this room will have an opportunity to have reviewed the Child Death Review Annual Report for 2023-24. And to see of the 3 biggest intersecting factors that contributed to cases that were reviewed by that committee, that board, of which 70 were reviewed last year, housing instability was a significant causal factor or contributing factor. We know many of our children and families are experiencing that, and we know that housing is not a solution in isolation to the wraparound supports that are needed for families, but it starts with safe and secure housing. We are doing some work that we'll be announcing shortly together with Q Shelter, the peak body for housing in Queensland. And over the coming weeks, we hope to be able to announce some really exciting work around how we can join up some preventative efforts around looking at what are the intersecting drivers of kind of adverse experiences and how we can actually shift that dial before it becomes a crisis, whether that be in disability support or housing, whether that's in social inclusion and the increasing experiences of isolation in our communities for individuals, but also for our First Nations communities and the special significance that all of our actions must have in supporting our First Nations communities. So there is a lot of work that underpins that, but what we need to do is acknowledge and draw on the partnerships that we have in the housing space, particularly with Q Shelter as the peak body for housing, and the upcoming outcomes of the review being led by Rachel Hunter into the housing service system, of which I've had an opportunity to sit down with that review team and hear from Rachel Hunter around their focus areas, which very much include how do we support those families and people who seem to fall through the gaps of every service system. And we know those families because those families generationally will become part of our service system. Fiona.
Yeah, hi everyone, and sorry I haven't got my camera on. I'm just in transit, but can I just say thank you? Thank you to everyone involved with this work, and I was actually reflecting on the themes, and I think we'd all agree there's opportunity for us to continue to work and partner in the ways that have been described, and particularly thinking about elevating the voices of children and young people. It was probably just more a question, if you had any reflections, because I think the themes in terms of workforce, relationships and collaboration, whole system, if you had any reflections on sort of more inward focusing work that as a peak that you will do with the sector in and of itself. And I was thinking, just around quality of standard, quality of service provision, sort of just models of care, general approaches, which obviously the sector turns its mind to, as does government each and every day, but in a more sort of deliberate approach in the same way that we're thinking about these other collaborations.
That's a really great question, Fiona. Thank you for raising it and kind of acknowledging that all of this work has and continues to and will always be in partnership with government. And I think we have a shared aspiration for the outcomes that we're looking for. It's something we're really attuned to turning our mind to, is how do we as a sector, how do we as a child and family service system kind of create and hold those opportunities for meaningful change that aren't just reliant on government. We know that government kind of has a significant burden of responsibility, but it can't fix all the problems of the world. And we, as significant holders of expertise, knowledge and influence across the state, have a responsibility to highlight those opportunities, share the things that are going really well, continue to be modernising our own approaches to practice. And there is within the system itself that opportunity of we don't need to wait for government before we can do many of the things that we want to do. And we see that happen every day. I'll give you a practical example, which I can share across and which will then extend into an open invitation to all organisations who are members of Peak Care, is where we see organisations doing really amazing innovation. And there's an organisation up north who's doing brilliant work at the moment, supporting families and communities around crisis support outside of the traditional child protection system. They never get an opportunity to sit back and reflect on that model in a way because they're so busy delivering the model. Like, there is so much demand across every part of our sector to actually just do the delivery of great work that you never get a chance to sit back and say, you know what, how do we lift this up, showcase this, kind of create an opportunity for other organisations to say, you know what, I think I could probably do that as well. I'd love to actually maybe think about expanding my service portfolio to offer that in a different part of the state. And who do I need to speak to? So over the next 12 months and ongoing, we'll be looking for those models, those approaches that are genuinely innovative and unique, not waiting for government to say, you know what, government should amplify that, but saying as a sector, we have a responsibility for acknowledging the best of our work, highlighting where that can be shared to inspire other organisations to say, I can learn from that and lift up my practice through that. And I think as a sector, one thing that I'm really proud of, and I reflect back for many of us who met in November over a couple of refreshments in Brisbane, is we share so well. And so much of our work is done so uniquely in partnership with each other through a shared commitment to delivering great outcomes, that it's more about how do we create an opportunity for our sector to come together to actually share that great work. And as a peak, how do we create the space and hold that space for the sharing? And then how can we be there to support those evaluations that might be needed to translate really great practice into something that actually can be picked up and expanded beyond a single location. So that will be our work as to what can the sector lead as a sector, and then kind of champion in its own right while working alongside government, because that's that shared accountability and responsibility we have for giving the best possible outcome for children and families, and it's going to take all of us together to do it. So a great question and an ongoing, enduring challenge, but anything that we see in our sector, we want to hear and amplify. So thank you, Fiona. Tammy. You might be on mute, Tammy.
Sorry, too quick. I just want to acknowledge the work that you guys did in pulling all this together and making sure that you did go and see all parts of Queensland. I think that was really important. I'm really interested in the next 2 years, because your last statement was, we don't want to be here in 2 years' time, like we've been here for the many, many, many 2 years before. So really keen to work with yourselves and all other agencies to how do we make the changes and be brave to put our changes forward to department and not wait for them to tell us what we're going to do. So, yeah, looking forward to it. Thanks, guys, for all of your help.
Thanks, Tammy. Look, that's probably a perfect segue into the next steps in terms of, I completely agree, is we as a peak body have changed significantly in the last 2 years and look to kind of be reflective of a sector that is also changing at pace. And if you look at this sector from a 10-year snapshot, it is so different. But we know that there are entrenched issues that we have yet been able to shake. And we need to be really committed to saying, as a peak body and your peak body, we only exist to create and provide value to you as a service system who are doing the most valuable work. And this is what you've told us, and we've coalesced from all of the state's conversations is what we have heard as to be your highest priorities. And there's some opportunities in there to really kind of make a meaningful shift. It's not an exclusive list of the only things we'll work on, but what we want is to acknowledge that these are the things that we have heard and have been asked to kind of work on that we see collectively as a service system will create opportunities to make the biggest difference. There is a lot of actions that come out, and I mentioned there's 3,000 on government around child protection, which is overwhelming in its own right. And some of us get a bit of action fatigue in terms of all the things we need to do, but these are really important to us. So what we are going to do is actually to monitor, like deliver and report back to the sector on how we are progressing against these actions, because you've given your time and expertise to us. It's responsible of your peak to actually tell you how we're going with each one of these. So on a alternating annual basis, on a regular basis, what we'll actually be doing is giving you a report back on what have we done for each of these. Like, what is the meaningful, tangible change that you should be able to see for each of these actions? Where are we getting stuck? Where are we moving forward? What's changed since? But to actually report back to you to say, hold us accountable for the work that we are intending on doing and being transparent about that. So in November of this year, and I know it will be because we'll coincide it with an AGM, because otherwise AGMs aren't very fun things to do. We intend to report back to you on what we've done, like how we've actually made a meaningful difference. I know at the moment, in speaking with organisations, that from July last year to where we sit today has probably been one of the most significant disruptive changes that you've seen in the service system in 10 years' time. That's only a disruption that we experience at the executive level. The frontline workers are doing great work every day and probably not noticing too much the existential change that we experience when it comes to changes of government, changes of strategic reform. But at the end of the day, great work continues. But what we want to do is to be able to say, as a peak body, as your peak body, here is the things that you have told us are important to you, and here is our commitment to acting on that. And for you to be able to say, I can see through you that you are actually listening and trying to make a real difference for us. We will continue to add, change, reprioritize, and hopefully shift that dial. But our aspiration is in 2 years' time, there are new issues to talk about. The best achievement we can possibly have is to create the space for new issues to come in, because that means we're making change, as well as kind of reflecting the best of what's happening. Because I think the most important thing I heard across 11 workshops, across the 16 residential care workshops of 2023, I suspect over the next 24 workshops we have for Catalyst for Care over the coming months, is that there is so much great work that we need to recognise and continue. And it's about creating the space for that great work to continue while acknowledging that there are things that we need to shift that continue to get in the way. And ultimately, at the end of the day, it's about creating a space to deliver better outcomes for children, young people and families, and that's something we can all get behind. So on that note, I want to thank you for your contributions, for your participation, for the contributions of your teams across Queensland, for your insights, for everything that you've contributed to the peak over the last couple of years, and again, everything that you will contribute and will contribute back in kind. We are really proud to be your peak body, and we want you to hold us to a standard of reflecting your views, your voice and your aspirations. So please get in touch, please ask questions, please hold us to say, where are you up to with that? You said you were going to do it, tell me where you're at. We only exist to support you. So we really want to be a great resource for that. And again, I want to thank you for that. You will receive a copy of the report together with a bit of other additional information. Otherwise, if there are no further questions, I want to thank you all and give you a slight early mark back into your day. And I look forward to speaking and hearing from you very soon. Thank you, everyone.
Thank you, everybody.
Thanks.
Thank you. Bye.